Today, we are going to see about gingiva. It's a part of a periodontal subject. Right? It's a basic tissue. We are going to see about the gingiva, in and out of the gingiva. What is the gingiva? Gingiva is the part of the oral mucosa that covers the alveolar process of the jaws and surrounds the neck of the tooth. It is the outer covering of the tissue. So when we see a tooth structure, we see the outside part. It is covered by gingiva. Like a book cover, it covers the tooth. So when the part of the gingiva is exposed, the root get exposed, and it causes mobility and periodontal issues. So gingiva plays a vital role in the periodontium. So gingiva is anatomically classified into marginal gingiva, attached gingiva, and interdental fibers. So when you see a oral mucosa, the structures surround the tooth is called as gingiva. So the gingiva is subgingival into marginal gingiva, attached gingiva, and the interdental papilla. The marginal gingiva and the attached gingiva are in linear position, while the interdental papilla is between the two tooth structures. So gingiva is the part of the oral mucosa. So when we see a oral mucosa, we can see the buccal mucosa and the gingival alveolar mucosa. The alveolar mucosa is composed of gingiva. The separation between the buccal mucosa and the alveolar mucosa is called as mucogingival line. So we'll see about what are the parts of the gingiva. So inside the gingiva, we have epithelium and the connective tissue. And outside, also we separate the gingiva into outer and the inner. Inner comprises of the epithelium and the connective tissue. Outer surface is classified as gingival, marginal gingiva, attached gingiva, and the interdental papilla. Inside the gingival tissue, it is classified as epithelium and the connective tissue. The oral epithelium is this epithelium is further classified as outer epithelium, sulcular epithelium, and junctional epithelium. So you will see in difference. So marginal gingiva is the terminal edge or border of the gingiva surrounding a tooth in a collar-like fashion. It is 1 mm wide. And the attached gingiva, it is firm, resilient, tightly bound to the underlying periosteum of alveolar bone. It is demarcated from the alveolar mucosa by the mucogingival junction. So part of the important part of the attached gingiva is the width of the attached gingiva. So how much is the attached gingiva is? So we have to know the width of attached gingiva as it plays an important role in the periodontitis. If there is less width of attached gingiva, there is more amount of periodontal disease happening. So we have to know about the width of attached gingiva. It is the distance between the mucogingival junction to the projection of the external surface of the bottom of the gingival circles or the periodontal pocket. So it is greater in maxillary region and is average in mandibular region and least in premolar region. So these are the measurements of the attached gingiva. So width of attached gingiva is equal to the width of keratinized tissue. So if there is more amount of attached gingiva, the patient is healthier, is having a healthier gingiva, is having a healthier keratinized tissue. That is all. Then we see about the interdental gingiva. It is a part of the gingiva. It is a part of a marginal gingiva, but it is between the two teeth. It can be pyramidal or a ball shape. Ball shape represents a valley-like depression that connects the facial and the lingual papilla and confronts to the shape of the interproximal contact. It occupies the gingival embrasure space beneath the area of the tooth contact. So this is how the structure of the interdental papilla. It is usually pyramidal in structure, and in slice wise, it is polystriate structure. It have a valley-like depression. The outer is facial papilla and then lingual papilla. So the dimension of the caul plays an important role in the attachment process. It is more in the premolar region and it is lesser in the molar region. Next, we have about the gingival sulcus. Gingival sulcus is a shallow crevice or space around the tooth bounded by the surface of the tooth on one side and epithelium lining the gingival margin on the other side. It is V-shaped Ideal depth is 0 mm and close to 0 mm. The probing depth of the clinically normal gingival sulcus is 2 to 3 mm. So we have seen about the parts of gingiva. Now we have seen about the outer epithelium. Outer gingiva is marginal gingiva, attached gingiva, and the interdental papilla. So inner part of the gingiva is called as gingival sulcus. It is closely attached to the tooth surface. So we have to know the depth of the uh, gingival sulcus. If it is a deep gingival sulcus, it causes a periodontal disease. Next, we see about the microscopic features. We have seen about the outer parts. Now we have seen about the macroscopic features. Now we see about the microscopic features. Microscopic features like any other tissue, it consists of an epithelium and a connective tissue. The epithelium of gingiva is classified as oral or outer epithelium, sulcular epithelium, junctional epithelium, and the cells basically of this epithelium are keratinocytes and non-keratinocytes. So the non-keratinocytes are Langerhans cells, Merkel cells, and the melanocytes. Keratinocytes. Keratinocytes are the principal cell type of the gingiva. So these are the function of the gingiva is to protect the deep structures and allow selective interchange with the oral input. It is achieved by the proliferation and differentiation of the keratinocytes. What is the importance of keratinization? It is involves the sequence of biochemical and the morphological events as cell migrates from the basal layer. Main morphological changes happens is progressive flattening of cells with increase in prevalence of filaments, intercellular junction coupled to the production of keratohyalin granules and the disappearance of the nucleus. So this is the process of keratinization. So we see the epithelial layer classified as stratum corneum, stratum granulosum, stratum binosum, and stratum basale. So in this, we can see the nucleus getting disappeared as it goes to the stratum corneum. So this is the process of keratinization. So we have three types of keratinization. One is ortho-carotenoidization, para-keratinization, and non-keratinization. The tissues of oral tissues are usually ortho-keratinized, and gingival sulcus are para-keratinized, and the other junctional epithelium are non-keratinized. Ortho-keratinization is a complete keratinization, that is no nucleum in the stratum corneum, well-defined stratum granulosum, only seen in the some areas of oral epithelium. Para-keratinization is the most prevalent form of keratinization. Stratum corneum retains the pycnotic nucleus. Keratohyalin granules are dispersed, not giving rise to the stratum granulosum. Non-keratinization has either stratum granulosum or stratum corneum. Its superficial cells have viable nuclei. And we have some proteins also produced during the keratinization, that is called keratins, and others are keratolinin, involucrin, and filaggrin. All these forms the most differentiated epithelial cells called as corneocytes. So this is the corneocyte picture. Keratinocytes are interconnected by structures on the cell periphery called as desmosomes. This is the structure which holds the keratinocytes. Less frequently observed forms of epithelial cell connections are tight junction, that is called as zonae occludens. So this is the picture of desmosomes. And we see about the non-keratinocytes. Langerhans cells, located in the suprabasal layer among the keratinocytes, belongs to the mononuclear phagocyte system. Important role as antigen-presenting cells found in the oral epithelium of normal gingiva and small amount in the sulcular epithelium. So this is the first line of defense in the gingiva. So it is present in the epithelium. And we have Merkel cells present in the deeper layer of epithelium, contains nerve endings and connected to the adjacent cells by the desmosomes. The main function of this Merkel cells is tactile receptors. So when we feel a probing pain or anything, that is due to the cells, Merkel cells present in the gingiva. And the color of the gingiva is based on these melanocytes. These are dendritic cells located in the basal and the spinous layer. These synthesize melanin in organelles called as premelasomes or melanosomes. So we have seen about the structural and the metabolic characteristics of outer epithelium, sulcular epithelium, and junctional epithelium. So this differentiation of these three types of epithelium. So outer epithelium covers the crest and the outer surface of the marginal gingiva, the surface of the attached gingiva. It is 0.2 to 0.3 mm in thickness. Cellular epithelium, it is a thick, non-keratinized stratified squamous epithelium without pretipex and extends from the coronal limit of the junctional epithelium to the crest of the gingival margin. It acts as a semi-permeable membrane through which injurious bacterial products pass into the gingiva and the tissue fluids from the gingiva seeps into the sulcus. And the important epithelium is called as junctional epithelium. It is a collar-like band of stratified squamous non-keratinizing epithelium formed by the confluence of the reduced enamel epithelium and the opaque epithelium. This is 3 to 4 layers of thickness but increases with the age of 10 to 20 layers. Attached to the tooth surface by the internal basal lamina and the gingival contraction by the external basal lamina. Attachment of the junctional epithelium to the tooth is reinforced by the gingival fibers. So, junctional epithelium and the gingival fibers considered as a functional unit called as dentogingival unit. So, dentogingival unit is a part of junctional epithelium and the gingival fibers. We've seen about the various types of epithelium. So how does the gingival sulcus develop? It is the shallow crevice or the space around the tooth bounded by tooth on one side and epithelium lining the free marginal gingiva on the other, formed when tooth erupts into the oral cavity. Gingival fluid is represented as a transudate or exudate used as a biomarker for biological state of periodontium. So these are the important features of the gingival epithelium. Next, we see about the gingival connective tissue. So gingival connective tissue is also known as lamina propria, consists of two layers, one is papillary layer and the reticular layer. Connective tissue has cellular and extracellular elements composed of fibers and ground substance. So ground substance mostly of proteins, glycoproteins, proteoglycans and mainly fibronectin. And we have three types of fibers, one is collagen fibers, elastin and the reticular fibers. So these are the principal and the secondary gingival fibers. We should not confuse with the gingival fibers with the periodontal fibers. Gingival fibers is a part of the connective tissue of the gingiva. Periodontal fibers or attachment of the periodontium to the alveolar bone. So these are the gingival fibers. We have gingival fibers, principal fibers. We have gingivo-dental group. Gingivo-dental group, they protect from the cementum in a fan-like conformation towards the crest and outer margin of the marginal gingiva. They provide the support to the gingiva, attaching it to the tooth. Alveolar gingival fibers, second part of principal fibers, they extend from the periosteum of the alveolar crest coronally into the lamina propria. Their function is to attach the gingiva to the alveolar bone. Dentoperiosteal fibers, they arise from the cementum near the cemento enamel junction and inserted into the periosteum of the alveolar bone and protect the periodontal ligament. Circular fibers, they surround the tooth in a ring-like fashion and pose through the connective tissue of the attached and marginal gingiva. Transeptal fibers, they are located interproximally and extend from the cementum of one tooth and insert into the cementum of the other tooth. Their function is to protect the interproximal bone and maintain the tooth-to-bone contact. Periosteogingival fibers, they extend from the periosteum of alveolar bone to the attached gingiva. They help to attach the gingiva to the alveolar bone. Interpapillary fibers, they are seen in the interdental gingiva, extending in a facial inward direction and support the interdental papilla. Transgingival fibers, they are seen in around the teeth with the attached gingiva. They maintain the alignment of the teeth in the arc. Next is the intercellular fibers. They extend from the cementum on the distal surface of the tooth, playing buccally and lingually around the tooth, inserting into the mesial surface. Intergingival fibers, they are seen with the attached gingiva attached to the basement membrane, extending mesiodistally. They provide support and contour for the attached gingiva. Semicircular fibers, they extend from the mesial surface of the tooth to the distal surface of the same tooth, confining of a half circle. Crystalline fibers, they present in the connective tissue fibers of the periodontium. Their function is still unknown. Next, we see about the cellular elements. So we have seen about the fibers, various fibers of the gingiva in connective tissue. Next, we see about the cellular elements. Cellular elements comprised of fibroblasts, which synthesize the collagen and the elastic fibers, mast cells, and macrophages, eosinophils, and mononuclear phagocyte system, eosinophils, plasma cells, and neutrophils. And the important thing about the gingiva is the blood supply and the lymphatics. So supraperiosteal along the facial and the lingual surface of the foot, vessels of periodontal ligament and arterioles from the interdental septa are the blood supply of the gingiva. You can see the picture of the blood supply of the gingiva, arteriole penetrating from interdental bone and supraperiosteal arterioles. Nerve supply, fibers arising from the periodontal ligament, labiobuccal and palatal nerves, Masonal type tactile corpuscles, Cars type bulbs, and encapsulated spindles. What are the correlation? We see about the correlation between the clinical and the microscopic features. So we see about the color, contour, and the consistency. Color is normal color of the gingiva is coral pink. It is due to the vascular supply and the thickness of the keratinization and the pigment melanin pigment. Melanin, as I previously told, it is the color form of the gingiva. It gives diffuse, deep purplish to the irregular light brown pigmentation. Changes in colors occurs during the systemic diseases like Addison syndrome, Albright syndrome, and Chuch-Jaeger's syndrome. So the cellular and the intercellular components with vascular supply gives the size of the gingiva. If there is increased size of the gingiva, there is increased amount of vascular supply or cellular components or intercellular components. So this is a pathological condition. Contour. Contour depends on the tooth shape and the alignment in the arc, proximal contact, location, and the size of the area of the contact, dimension of the gingival embrasure, and it is normally scalloped. So you can see the normal contour of the gingiva and is an abnormal contour of the gingiva. Next is shape. Shape according to the contour of the proximal tooth of surface and location and shape of the gingival embrasure. Surface texture, important thing, has a textured surface similar to an orange peel and it is referred to as stipple. Stippling seen on attached gingiva and the central portion of the interdental papilla. This picture we can see appreciate the stippling. This is a textured appearance is due to the projection of papillary layer of the underlying connective tissue, less prominent on the lingual surface. It is a form of adaptive specialization or reinforcement for the function. The surface contour is also related to the presence and degree of keratinization. Next, we see about the consistency. It is firm and resilient. So the gingiva is firm and resilient in normal gingiva and soft and erythematous in case of gingival inflammation or periodontitis. You can see the inflamed gingiva. Next, we see about the bleeding on probing. And position refers to the levels at which the gingiva attached to the tooth surface. During gingival inflammation, there is an exposure of the tooth surface due to the apical shift in the position of the gingiva called as recession. You can appreciate the gingival recession in the tissue. So thank you all for